Welcome to the September Okanagan Coalition for Health Improvement meeting. Like Michelle mentioned, we've got sort of three different topics today. The first one we're going to talk about real quickly, which is a new communication project coming from Okanagan Public Health. So we'll just spend a couple minutes introducing it to everyone here. The second piece, you'll hear from Jimmy Wallace and Nancy Nash-Mendez, and they are going to do a quick snapshot or reflection on some of the different community health issues we've been talking about here in the CHI for the past 4 months, all to sort of tee you all up for the second half of the meeting, which involves looking at some of the recent grant applications that have come here through the NCACH and are rooted in Okanagan County and some of our counties that are close by. So the first piece here is pretty quick. As you'll remember, it was 4 months ago, we spent some time at our CHI meeting asking you all about what you thought the communication priorities could or should be for public health. And one of the pieces that came out of this CHI meeting was a very strong draw to try to bring the business community even closer into some of the COVID-19 prevention work that needed to happen. And most of us know very intimately that business leaders have just gone to work to try to help us slow the spread of COVID-19, and they have been incredible by and large. Public health, and with the leadership of Lori Jones, has also really helped us think about how we might be able to continue to reach out to some of those businesses who are either struggling with compliance or working their way to compliance in terms of best practices for COVID-19 prevention. So we are excited to be able to announce, again, a new project that's coming from Okanagan Public Health, called the Okanagan County Business Pledge. I'm going to share my screen, and you all are going to be the first folks to see the new website that will be up on Monday. I say I'm going to share my screen, and there it is. Great. Okay. So the business pledge is called COVID Safe Because We Care. That's the logo you see there. The idea behind the business pledge is that businesses will be asked to sign literally a 9-point pledge that Okanagan County Public Health came up with input from about 10 businesses, some great guidance from the Okanagan Economic Alliance. I know Ronnie's on the phone here. She's incredible. When businesses sign the pledge, they'll get their business name listed at the bottom of this webpage. They'll also get this sticker, which looks like the decal you'll see on the webpage, and they'll get it posted up in there. They'll be able to post it on their website and also post it in their local business. So this project itself is actually not going to roll out until Monday, but we wanted to let you all know here at the CHI for a couple reasons. One, just to say thanks genuinely for all of the input. I think you have been so thoughtful about providing across the past couple of months. And also just to set you all up to help encourage local businesses to sign on to this pledge. Another person on the call here who I want to introduce you all to is Jessica Kuzma, and she's working with Okanagan County Public Health Communication team. Jessica will be sort of a point of contact for the Business Pledge project. So come Monday, when we move this out through social media, start calling businesses, knocking on doors of businesses, Jessica will be deeply connected. And of course, Lori Jones and Crystal Eshelman have really been at the heart of this project from the very beginning. And our very own Peter Morgan, who's also on the CHI Leadership Council, has been helping to drive it. So that's my quick introduction. I'm curious, any questions about this pledge? You're welcome to chat in any reflections or turn your volume on and let us know.
So maybe I would have a question. So it sounds like this would be a voluntary situation, which sounds great. Moving voluntary forward would be the best way to go about it. But for those businesses or individuals that may not have that ability or choose not to, at this point in time, would there be any consequences moving forward?
That is a fantastic question, Donnie. And thank you, Dela, for encouraging me to scroll down my screen so you can see the pledge. I think that's very useful. So please, I encourage you, continue to exercise the chat box as much as you can. So Donnie, you're right. It's voluntary participation. There is not going to be an enforcement mechanism for this. So if a business signs the pledge and then someone walks into their facility and they see that an employee, for example, is not wearing a mask correctly, Certainly, we'll encourage businesses to comply, but in the end of the day, I think there's so many layers, and Ronnie was so helpful in supporting us and thinking this through, that make it really difficult to actually oversee these pieces. So at the bottom of the pledge page here, you'll see that public health is very clear that they're not actively monitoring those who sign up for the pledge, but they're relying on them to keep their word. So the components of the pledge, which I'll walk through really quickly, are one, making the message clear. So display mask required signs at your business, and we have downloadable infographics for folks. Wear facial coverings correctly. So that means your employees wearing facial, and business owners wearing facial coverings that cover both their mouth and nose at all times. Have a plan to engage people who don't wear facial coverings in their business. So we know that this is a really tricky one for a lot of businesses. We have a downloadable tool that people can get to learn a little bit more about how to have some of these conversations, or just generally how to set a plan so that their employees feel safe, and that no one is put into an unsafe situation when they have these conversations. Keep sick and COVID exposed employees away from work. So ask an employee who's been exposed to COVID-19 to not come into work.
Yeah, I missed it, but I haven't heard anything about it.
Michelle or Sahara, if you hear background noise, I'll have you kind of control that from the back end. Supporting sick employees. So as much as folks can, think about supportive employees or supportive policies to utilize when an employee does get sick. Make the space as safe as possible. So many of you have been in businesses who've done a great job trying to keep 6 feet of distance between customers when they come in. Keep the business clean. Share information with employees. So make sure their employees know about what the responsibilities are for local businesses, and also encourage employees to self-screen. And then lastly, just caring for each other. So treating everyone who walks in the door with kindness and care and respect. That's the pledge. Curious to hear any questions. Sorry, Peter said, or they're not Peter's asking me, are there consequences for not signing the pledge? There are no consequences for signing the pledge. I think the benefit to signing the pledge is that your business gets listed on this webpage. So people will be going here looking for folks who have signed the pledge. They'll also get listed on social media as a COVID safe business. I think our hope is that this is an activity that supports small businesses in continuing to be received as a safe place for folks to go.
So can I ask a quick question?
Please.
All right. So my understanding, and please correct me if I'm wrong, the folks that take this pledge, it's not only posted on web pages and the like. It's also, they have a decal for their window. So if I'm going downtown and I'm very, my family is very much wanting to support small business, but we want to be safe as well. If we're walking down looking for a restaurant or a store, would see that decal and know that that's a safe place for us, that they're taking all of the precautions necessary to keep my family safe. Is that how I'm understanding this?
Yeah, I think that's a great reflection, Dale.
Oh, thank you.
Yes. I think the hope is that all potential customers, folks who could go to stores, will know that they're walking into a business who's working as hard as they can to keep their space safe.
So I really appreciate this also, because when it comes to referring folks that are they want to make sure that they're working with somebody who is also safe. So this is a fantastic thing that these folks have done, and I am very excited about this. Thank you so much for sharing.
Oh, that's great. Any other questions, thoughts, feedback?
This is Ronnie. I just wanted to throw out there that we'll be looking at the local chambers of commerces to try to get this information out to their memberships as well. So hopefully we will be able to promote this program, get it out there as soon as possible, and start seeing people businesses taking the pledge and moving forward.
Thank you, Ronnie. Okay, I will stop my screen share. And again, you all are going to hear a lot more about this in come Monday when it becomes a little more public. So thank you. Let's see here. Moving on to the next piece, I am actually going to start a really short video that I put together today for you all. It's just a 3-minute introduction to what's coming next. The idea was really trying to talk about why COVID-19 and community health are topics that we as a CHI want to and choose to continue to spend time talking through and to share a little bit of new information with you all. So I recorded myself for 3 minutes talking, so please be generous with me. It is just a brutal activity. So please know that the message is good, the filming is not. So with that, I'll share my screen for you. Hi, everyone. So across the past couple of months, we spent quite a bit of time talking with our Coalition for Health Improvement about the intersection of COVID-19 and community health. And we centered on this topic for a couple of reasons. Number one, we know that some of the community health issues that existed before COVID-19 make us even more vulnerable to the pandemic. And on top of that, the pandemic itself makes community health issues that already exist even worse and has the potential to create new and different community health issues that need to be addressed. So I'm going to share a graph with you all, which I'm sure is familiar to you. Many of you have seen it. And it shows the surge in cases here in Okanagan County relative to the rest of Washington State. The graph that I'm showing you comes from a COVID-19 health equity interactive dashboard. So this website also talks about some of the county characteristics that impact an individual's risk of infection of COVID-19. And they also tell us that counties with a large number of vulnerable people might be disproportionately impacted by COVID-19. So I think the tools they've created are really interesting and really informative for us as a CHI, because they help us see some of the ways in which our community was both already vulnerable to something like COVID-19 and help us think about how we in the future can better position ourselves to prevent a pandemic like COVID-19 from affecting us so severely. So some of the county characteristics that popped out to me. So 19.7% of Okanagan County's population is Hispanic, and there's a 12% Washington State as a whole. We also see that Okanagan County has a 20% poverty rate compared to only 11% in Washington State. Okanagan County has a 14% uninsured rate compared to only 7.5% in Washington State. We also have a substantially larger number of people who are over the age of 65, and 2.7% of our population live in group quarters compared to only 2% of Washington State as a whole. But you all at the Okanagan Coalition for Health Improvement, you know these things. You know that if we're struggling with housing before the pandemic, and the pandemic hits, housing is actually going to become even more difficult for people. You know that if people can't afford the health insurance that they need out here, and that a pandemic hits, it's going to be even harder for them to stay safe. As a Coalition for Health Improvement, you all know these things. But we spent the last couple months doing as much as we can to better understand them and to do the work to help you all as members keep thinking about ways in which we might be able to address them. So in preparation for the second half of our Coalition for Health Improvement meeting, I'm inviting Jimmy Wallace and Nancy Nash-Mendez to reflect back on some of the community health issues that we've learned more about through the Coalition for Health Improvement across the last couple of months. Okay. So I'm going to pass the virtual screen over to Jimmy Wallace and Nancy Nash-Mendez, who actually recorded a conversation on Tuesday with me. So I'm so sorry you have to continue to watch me for another minute here, but then I promise you will hear from someone other than me. So with that here, let me pull this up for you all to see a little brief introduction and reflection on community health issues that have been talked about in the CHI for the past 4 months. And special thanks to Jimmy Wallace and Nancy Nash-Mendez. Hi, everyone. Thank you for joining us for this September Okanagan Coalition for Health Improvement meeting. I'm here today with Jimmy Wallace and Nancy Nash-Mendez. Jimmy, why don't I let you introduce yourself, and then we'll talk a little bit about what we're doing. And Nancy, you can go right after Jimmy.
Sure. Hey, everybody. I'm Jimmy Wallace. I'm the medical director of Family Health Centers. Work as a primary care physician, a family physician throughout Okanagan County, mostly in Brewster and Twisp. Also get to work at Three Rivers Hospital and Mid-Valley Hospital, and play a role in supporting all the healthcare providers, as well as clinical services for family health centers. Enjoy interacting with all the different communities throughout the county. And as we broaden our scope and recognize that social determinants of health are so essential in providing care to our patients and communities, I've really enjoyed reaching out and working with all of the partners throughout the community and organizations that are also focusing on keeping the county healthy and thriving, and trying to fill in the gaps where services are needed.
I am Nancy Nash Mendez. I'm the Executive Director of the Housing Authority of Okanagan County, your Housing Authority of Okanagan County. Our mission is to connect community members with who are in needed housing with housing. And also our broader umbrella is to be an intricate part of being a solution, bringing a solution to the various social determinants of health. And as we all know, housing is a big part of bringing the equilibrium to the social determinants of health. And we're here to serve you. And we are very, very happy to be part of this conversation today.
Good, Jen. So as our CHI members know, for the last 4 months, we've been talking a lot about COVID-19 and how it's affecting different community health issues. And we have covered a lot of different topics, from wildfires and COVID, how those two things come together, to housing access, to mental health, the effects of school closures. And what I asked Jimmy and Nancy to come and join me to do today is to reflect on some of those key community health issues that we've talked about across the last 4 months. The first one that I have on our
See you later, alligator.
and which populations might be most affected.
Alana, I would like to start out with a short story, and maybe Jimmy can augment what I said. On my way to work, the Housing Authority, on a daily basis, I drive by the food bank, the Okanagan food bank. And I have been doing this for years, of course. What really was the increase of numbers waiting in the parking lot, the amount of cars and people without cars waiting for the food pantry or the food bank to open. Mm-hmm. And this could, some people are out there very early in the morning, think about 6, 7 in the morning. And I'm right now, for example, it's getting a little chiller in the mornings, and I begin to worry. The number of people waiting for the food bank to open to get their supplies has increased just from my eyes as a passerby. I know that during the summer months, it was perhaps comfortable to wait on that parking lot. I worried about these people during the fires. Mm-hmm. In fact, I personally purchased some masks and stopped by the parking lot and hand out some masks to the people who did not have masks, but as they were waiting for the food pantry to open. But also I'm beginning to think, as a community member, I'm beginning to think, what will happen to these people? How will they wait during the harshness of our winter months? Mm-hmm. Jimmy, what have you heard or seen?
One thing that really hit home for me was that when our schools closed, many families lost a primary source of nutrition for their children. That one of the most essential roles schools so often play is providing that lunch and oftentimes breakfast and an afternoon snack for kids. And families really were finding themselves in a state of hardship or increasing hardship because those options weren't available. And I'm so impressed with the way so many school districts in our county responded to that and continued to provide meals and mealable. But I think it made it even more clear to me how pervasive and widespread food insecurity is across our county. And an economic hit like COVID, economic hit like the wildfires, just puts that population at so much greater risk.
You know, I think that's a nice, I would say just a spot-on way for us to talk about one of the other community health issues that we spent some time on in the last CHI meetings. I think it was the CHI meeting in August, and that was the effect of school closures on community health. Yeah. And some of the pieces we heard, just to reflect back, and then I'll turn the virtual microphone back over to you both, was that in the Latinx community and the young people community in general, there's a low trust in telehealth, which is one of the primary service access strategies for quite a few health clinics, mental health resources. Limited internet access. We heard from Brewster that almost half of the families didn't have access to reliable internet. We heard from Pascal Sherman Indian School a concern about an increasing achievement gap and limited access to not just food, which you mentioned, Jimmy. I think a lot of young people rely on their school to get food, but also limited access to healthcare because they were no longer going to see the school nurse. And I think this is just an interesting note, but both school districts talked about the gap in getting access to glasses and optometry, which was really interesting. So I wonder, Nancy and Jimmy, if you have any reflections on how school closures because of COVID-19 might have or has had additional layers on community health here in Okanagan County.
Yeah, I think just building off of what I guess embarrassingly came to realize is an essential role of schools, because I'm sure there are many people that have acknowledged that for a long time. That, you know, our schools are pillars of our communities, and you know, it's such a big part of the life of our young people that are attending schools and the families whose children are attending schools. But so much of community life revolves around the schools. And when that gets shut down, it leaves a huge gap in the lives of so many people. And we find ourselves, you know, in crisis trying to replace, you know, what kids do with their time, or the meals that kids are accustomed to having, or, you know, access to glasses, or access to a nurse, access to a behavioral health counselor. And I think we still have school closures, and as we begin to open more and more schools, the reality that some then might have to close again, and continue to build partnerships with schools, because one of the most beautiful things I've seen arise out of this is partnership between schools and behavioral health organizations, schools and clinical organizations, and sharing of ideas and resources and acknowledged overlaps in services. And I think it's a great template for work within the CHI, and recognizing where our overlaps in our services are, and how we can collaborate and have synergy in those areas, and then identify gaps as well, and recognize where our community is needing us to step up in more ways and provide a better service. I'm sure Nancy has good input and insight on this as well.
I also ponder about the big monumental role we're asking these parents to do to home kids, while some parents may not have the know-how, the intellectual capacity, or perhaps who has forgotten, has been in school too. And how do we come together as community members? And what is the role of the CHI in engaging community members who may come in alongside with these students who do not have the support at home, or who the parents who are both working and whose employers cannot give them the opportunity to work from home. How can we together as a community come in and support? We are living under a pandemic. We need to find ways to redefine how we do community and how we nurture and care our most vulnerable, who are our children.
Yeah, as an employer, Family Health Centers with close to 250 employees, we did a survey a few weeks ago about the impact of school closures on our workforce, and over 50% have been or will be affected and will have to miss work because of the school closures, and are stressed about that, are torn between oftentimes as healthcare providers working on the front lines and serving the population amidst this crisis, but also taking care of their kids at home. And it's just such a crux and challenge. And from a infection control epidemiological perspective, it's dangerous to send kids back to school. You know, the preschool that my kids attend is a petri dish, and you know, and sharing of mild viruses and germs is just a part of it. But when we throw in something that can be more catastrophic, especially to vulnerable populations, we've really got to be careful about that. And I appreciated seeing like a lot of the plans that schools have in place, and love the conscientious effort schools are making to open safely when they do open, and to be very, very, very careful about screening and distancing and masking, and being very conscientious about that. But Nancy, back to your point, it all is rooted in the social realities that our patients face. And again, those who struggle the hardest to support their children and balance that crucial, values of work and childcare are really finding themselves in a crisis situation here.
I think it's a helpful way for us to talk about another issue that I know we talked about relatively lightly at the CHI meeting, but DCYS, the Department of Children, Youth, and Family came on a couple months ago and talked about the fact that intakes for child abuse and neglect were actually decreasing, but their perception is that child abuse and neglect is not. And of course, you know, I mean, I hear both of you reflecting that families are stressed, kids don't have access to their safety net at schools. So I wonder if one of you might give a little bit of community context for why there would be a decrease in intakes at a time like this, and the perception that child abuse and neglect is actually not going down.
You know, we've seen a decrease in a lot of our services as an organization providing clinical services, and that's, I think, because people are scared of going to a building where people might be sick, or people that they don't know might be there, and they aren't sure of their exposure risk in accessing those services. I could see that people are making similar decisions about child abuse and neglect, and that might be a reason for intakes decreasing. I think similarly, we're seeing exacerbations of chronic disease that you think would prompt an intake into a healthcare facility or a visit with your doctor, but people are, foregoing that care, and illnesses are getting worse at home while people try to maintain their health alone without the resources. And so I think we're seeing the same with domestic violence, child abuse, neglect, and all compounded by the tremendous that we're all under. And that's impacting, I think, the safety and security of children.
One of the things we heard early on too is that many of the referrals for child abuse and neglect come from the school system and often come from healthcare providers. So when I hear you say, Jimmy, that folks are choosing to see their providers with less frequency, and we know that school teachers and counselors are just not getting their eyes on kids in the same way that they used to. it makes sense that those referrals start to go down. Certainly there's a lot of dominoes that fall when those young kids, when kids don't get connected to the resources they need in those times of crisis. One of the things I heard you just talk about, Jimmy, was about healthcare access. And we talked about this early on. The dog's barking in the background here. As we talked about COVID and community health. One of the things we heard from the hospitals, so Mid-Valley Hospital, Three Rivers Hospitals, North Valley, and some from family health centers, was that the nationwide data showed that people were delaying care while their conditions were getting worse. And Jimmy, I heard you say, maybe that's connected to some concern about going into a public space or increasing exposure to COVID. Any other thoughts or reflections on healthcare access that might be useful for the CHI to know about in terms of COVID-19 and community health?
Yeah, I'm so impressed with how quickly the healthcare system responded on all levels. And in our clinic organizations, we had talked and dreamed about telehealth for decades as a new technology that was just so far out of reach because of technological challenges, but also because of regulatory structures. And that was all lifted, and within just a few weeks, we were all up and running with video visits and phone visits, and providing people with a safer alternative to in-person visits. And that very often was appropriate. And we thought that would last for 2 or 3 months. And here we are 6 months later, still encouraging a lot of video visits. And we've written and revised guidelines about who should or shouldn't be coming in for in-person visits. And one of the first things we wanted to delay was the routine care, the wellness visits, and the follow-up for patients with chronic disease. And that's all well and good for a couple months, but you can't let the most vulnerable patients fall off the radar. And so we've had to put a lot of effort and investment into more proactive forms of care where we do case management, care coordination, running lists of the sickest or most vulnerable patients for one reason or another, and trying to track them down if they haven't been seen in a while, or just make a phone call and check in and make sure they're doing well. But I think that approach extended to other sectors is really important. The hospitals similarly have been overwhelmed, and I'm impressed how well they've continued to chug along without some essential services, especially early on when they had to shut down surgery and procedures and their usual lifelines, and weren't having as many patients coming in, even to the emergency room sometimes. And then we're met with the surge where systems really felt like they were on the verge of being overwhelmed. The hospitals have really, each of the three have stepped up and done amazing work. They're still, on really unstable, unshaky ground because of external forces, as well as, patient volumes, staffing, and the struggle that they've, had for so many years in maintaining their services. And we've seen obstetrics drop from 2 of the 3 county hospitals in the past year, and that having an impact on who uses what hospital and volumes. And I think we're still in the middle of a hospital transition and need to continue with work that started, I think, 9 months ago or so, and saying, hey, what's the best countywide hospital system? We had great conversations about that amidst COVID. What's the best countywide system for, response to the pandemic? I think we learned a lot from that. I think we need to move forward and say, hey, how do we create a Okanagan County healthcare system that serves everyone and doesn't fragment care between hospital districts and exhaust the resources of all when we could cooperate and participate in a better way.
I wonder if I could pick up one, I think, really powerful thread in there, Jimmy, which is as the healthcare system started to experience the stress, I heard you say that one of the most effective responses you all had was to be super proactive about reaching out to clients, reaching out to patients, making sure they're getting the care they need. And I know that in a couple different CHI meetings, that same call came for access to mental health resources, thinking about ways to pivot the actual resources we had to be more responsive to where people were at. And Nancy, I heard you talk really early on about housing and what it meant for you all as an organization to switch and to, I would say, I think to sort of challenge the way that you typically provided services to make sure that no one was missed at a time when housing needs were really growing. Nancy, do you want to talk just for a minute about some of the changes you've seen in housing access out here and how COVID may have affected those things? And of course, if you want to just take a little bit of time and reflect on what you all have done to make your services so much more responsive.
Absolutely. Serving the whole Okanagan County always has been a big challenge for a small housing authority like ours, small staff at such a large area, geographical area to serve. COVID has taught us that it is very, very important to do a lot of the case management via phone and not expect people from Loomis or Grand Coulee or Masama to come into our office. And I think to all housing authorities' surprise, even HUD at the national level has provided housing authorities with tremendous waivers, such as, for example, we are required to do an annual physical inspection of the units that we are supporting with Section 8 vouchers. That has been basically set aside for a while until it's safer for our staff to come in to the units. The biggest challenge for us has been earlier on in like March, April, when we were still groomed, and the way we do business always has been in this rigid modus operandi that is set by HUD and other funders, the regulations, but having to come in like any other sector, trying to say, okay, the need is greater, how do we providing services with limited resources? Way back in May, we opened and closed the wait list. To this day, we grieve over the fact that we didn't have our community partners to help us with the referral processes for these new vouchers that we had. So now we are looking, our management team and the board of directors is looking at reopening the wait list and trying to find more creative ways in which we can do an outreach to make sure that the most vulnerable population, those who do not have access to internet or who do not have access to cell phone or phone calls, our phone lines, can still access our services. Another thing that I wanted to mention is that we have seen an increase of homeless youth with a small child or being currently pregnant. And unfortunately, like I said, we cannot help them with the voucher systems that we have, but we refer them to community partners as well. Putting a nexus between housing and school, the number of people coming in inquiring for housing and housing needs has increased tremendously in the last month for the housing authority. So once again, I always think that housing is that umbrella that brings stability to the social determinants of health. We can nail and work and try to alleviate the other social determinants of health if our community members have housing.
So one of the very last pieces we talked about at the CHI meeting, and then I know we are at time as a group here, was about wildfires and COVID-19. And we knew that some of the risks, so the populations who are at high risk for COVID-19 are also some of the same populations who are at high risk of being affected by wildfire smoke. So that include people who were in housing unstable situations, who are now, more inclined to have to stay inside, which increases their exposure to COVID. Mostly, I just want to reflect that back because I think it was such an important conversation in the CHI meeting and something I hope the CHI members continue to think about and reflect on. I just want to say thank you so much, Jimmy and Nancy. Honestly, I could stay here for another hour just asking you questions.
I feel like we just started.
I know, it's so
And I've got my own questions now. And maybe I look forward to the dialogue that this creates within the CHI, because I think it's a strong group, and I'm always so happy following those meetings with the strong work everybody's doing and the opportunities we have to collaborate. So look forward to action.
True. Yeah.
Yeah, and as the board member of the North Central Okanagan Communities of Health, I'm always very, very pleased and proud of our local CHI. I think we're doing great work, and as always, the work has just begun. COVID and the wildfires just added another layer of intensity, perhaps. But sometimes when we are in the war, we're in the arena, that is where we find more solutions, and we're here all together. And thanks for being part of our willingness to be part of being in the arena with all of us.
Thank you both so much. I really appreciate your time. I know how valuable it is. Okay, we'll loop back around soon. All right, thank you again, Nancy and Jimmy, for all of those, I think, really insightful reflections. And to cue up Michelle here, one of the reasons we, again, reviewed some of those key community health issues that we've talked about is that our next ask of the CHI is to give some feedback on different grant applications that have come in through the NCACH. And we are hoping that you as CHI members were just given some good fodder to ask questions about grant applications, to keep thinking about some of the community health issues that we as a community are facing right now. Yeah, hopefully we've set the stage well with some of those really powerful reflections. I'll also say, perhaps that gives you some ideas on where the CHI could be going next, and we certainly have plenty of ideas and topics on our radar, but as always, if there's anything you heard today that you want us to keep exploring and deepening as a group, don't hesitate to email Michelle or I, and I'll put our email in the chat box. Michelle, I'll pass the virtual microphone to you.
Excellent. Okay, so I think we are ready, Sahara. Sahara and I are going to take the mic, and we are going to get started with the second portion of this meeting, which is the public review for the NCACH 2020 CHI Community Initiatives funding. We received, the NCACH, I should say, received 37 letters of intent, and what that means is that each CHI ends up receiving an opportunity to review these letters. You received an email from me on Monday regarding how you can provide feedback. This is one way, so participating in the public review is one way. Participating in written feedback via SurveyMonkey is another way, and we encourage everybody to do that. On all 37 letters, if you can, across the region. On just the Okanagan ones, if you're low on time, or whatever portion of those 37 letters of intent that you are interested in. So I will drop in the link for that written feedback. Oh, it looks like Sahara has done so. Thank you, Sahara. And so what we're doing today is the public review, and I'm just gonna have Sahara click to our next slide here. Okay, so basically, Sahara, I don't know if you want to jump on, or if you want me to take on the description of the NCACH funding.
I can pop on here.
Excellent.
Trying to run my command center as best I can. So this is a unique funding opportunity that's been made possible This is the second time that we've offered this funding opportunity. It is not a traditional grants program, rather it is what we call a community investment process. And it's really an opportunity for our coalitions and our partners to come together to be able to come together and best decide how we want to invest a pot of money into the region. Looks like I didn't turn everything off before I started screen sharing. I apologize. And last year, sorry, 8 finalists were awarded across our 4-county region with projects ranging from a mobile food pantry to building resilience in Okanagan County. We also supported or ended up funding things like a sensory story time kit for children on the autism spectrum, and a variety of different things. You can learn more about it by visiting our website. But last year we awarded projects that range from $9,000 all the way up to $125,000. The funding is made available through our statewide Medicaid transformation efforts that my organization is undertaking in partnership with all of you. And this year we are especially excited because we are asking our local coalitions to really be active partners with us in terms of reviewing proposals, assessing proposals for their impact, and helping applicants actually strengthen applications before they even submit, as well as helping provide feedback that really assesses the proposal's fit for the region. Some of the goals for the proposals are outlined on the slide, as well as just a little spotlight about one of our finalists last year. But we're really looking for things that are addressing the social determinants of health in our communities, that are building local capacity, things that are really creating opportunities and pathways for more community and CHI involvement and engagement kind of as appropriate, as well as just increased learning. Many of these things that we fund are either new or expanding initiatives, and you know, we are really encouraging and asking folks to be innovative and to try things that maybe haven't been done before. And with that, we know that not everything we invest in will be completely successful, but there certainly are things to learn from and reflect from all of these endeavors that we take on and all of these projects that we ultimately end up funding. So one thing that we're really looking to funded awardees to after this process concludes is that you come back to the CHIs and you share how your project is going, and you let the CHIs know if there's opportunities for them to be involved or to support you with referrals or partnerships or things like that. And then for you to be able to share with us, you know, the things that you've learned along the way and the things that maybe can make our region stronger together. I kind of touched on it, but really looking at things that are encouraging collaboration as well as improving local health outcomes. Am I handing it back to you?
Yes, you are.
All right.
Okay. So the way we are going to do this public review is we are actually going to take 10 proposals today, 10 of the 37 that got assigned to the Okanagan CHI. And for those 10, we have a 1-slide summary of their letter of intent. And we are answering for that. In that slide, we're answering the need that this application is describing or trying to meet, and also a 1 to 2 sentence summary of their project proposal, which should include information like the goal, the method, and what results they're likely to achieve. We also have in a little box at the bottom how much funding the organization is requesting, as well as whether that budget is scalable for them. And then there was a 2-part question or a multiple choice question where they could say whether or not the project was new or expanding an existing project. And then also a list of partners or potential partners for the application. So I just want to give that broad overview, and then so that you kind of have that working template for the 10 proposals. And I'm going to pass it on to Sahara for the conflict of interest.
All right, and I'm going to tuck a link into the chat. So this was sent out by Michelle with the meeting invitation, but I actually we have a packet of all of the proposals that were submitted that will be reviewed today. That it's a big PDF. I recommend for you to really focus on slides, but I know that I'm someone who likes having a lot of extra, context. So I'm sharing that for context, but really we're asking when you are providing feedback today, really looking at what's on the slides. That said, though, we wanted to cover conflicts of interest because we do have, being a community investment process, right? We recognize that some of the proposals that you're going to see today, one, you may very well have submitted yourself as an applicant. We have invited our applicants to join us today. They have the option of choosing to participate in dialogue. There will be like a question that prompts them, or they can also attend in listen only mode. So it is completely up to applicants today on how much they want to engage or not engage with the CHI as they're sharing feedback. But one of the things we wanted to really cover was this idea of conflict of interest, right? So a conflict of interest occurs when an interested person's judgment could be affected because they have a personal interest in the outcome of a decision or is in a position to influence that decision. For our purposes today, we're really thinking about, providing feedback on proposals that may either have overlap with you, that you may have kind of direct connection or overlap to, or providing input on proposals that your organization either stands to gain or lose should that proposal be funded. So if you or someone you know is an applicant, as we are walking through these, we'll just ask you to refrain from providing feedback on that particular letter of intent. With this today, this feedback is really intended to help, like we said, really strengthen proposals and assess fit for region. So we're really just asking you to please use your best judgment. And if you think you have a conflict, go ahead and sit that one out. If you have any questions or you want to clarify anything, feel free to shoot me or Michelle a private message using the chat feature, and we will do our best to handle any kind of one-off things as they come up. Any questions for the good of the order about conflicts of interest before we move on?
So I will just say that we're going to start off with an example of conflict of interest. So as an example, the first one we're going to be doing an organization that I'm a co-founder of. So I'm going to step out. I'm not going to step out of the meeting, but I'm not going to participate in the live questions or as somebody who's providing points of discussion, but rather I'm going to step on the other side of this end, and I'm going to be just the respondent or the applicant as part of this first application that we're going over.
Wonderful. All right. So Michelle covered kind of the template and what you are about to see. So we're going to dive into this just for you as you're thinking about what to expect. You can, in a moment, we're going to show you the slide. It has the proposal information, and then we're going to use a few live poll questions for the group. We'll have a few spoken questions, and we'll be doing that for each of these proposals. We're trying, in the interest of time, we're going to try and keep these short. So when we are asking for our applicants to either provide clarifying questions or any kind of feedback clarification, we just want folks to know this is not a dissertation. We're not defending your dissertation. This is really about trying to understand the feedback that is coming in about these. And we do encourage folks, if you have kind of follow-up or more things you want to touch on, please use the chat box to connect with one another, and feel free to take these conversations offline. But in the interest of our time together today, we really want to make sure that all 10 of these proposals have the same opportunity to receive all of the feedback. So with that, we'll go ahead and get started. So this is the first proposal that we will be reviewing. This is submitted by the Foundation for Youth Resiliency and Engagement, also known as FIRE. Their project title is the Okanagan County Youth Health Equity Project. I will read the need and the project proposal statement, but I won't get too into the big funding requested box, and then we will transition into our first round of questions. So the need that this project seeks to address is At-risk youth in Okanagan County encounter barriers to social services, medical care, and education, leading to cascading health gaps. This project will begin to close those gaps through a culturally sensitive mobile unit and outreach services for at-risk youth, with the goal of achieving a county-wide referral system, youth service directory, and improving family/youth health literacy and meeting medical and educational needs through service coordination. That was a very big sentence, but that was great. All right, I'm gonna give this just a few more seconds for folks to just have a chance to read the slide, and then we'll transition to our first live poll question. All right, so what I'm about to do is I'm going to drop a link into chat, or if you are familiar with Poll Everywhere software, you can go to the URL that's displayed at the top. This is an open question. You'll go to pollev.com/SaharaSuval501, and that should take you into the survey. Once you're in, go ahead and answer the question. And the question on the screen for folks who may just be in by phone is, this project addresses a relevant health need or gap in my community? And you have the options to choose between strongly agree to strongly disagree. And applicants, there are some questions coming in for you in the comment box, so just keeping an eye on the comments as they come in. And where do you go to answer the poll? You go to pollev.com/SaharaSuval501. I'm gonna try, and my URL didn't hyperlink, so I'm gonna try and hyperlink it this time. Thank you so much, John. All right, wonderful. Give it just a few more seconds on that slide. And someone did a really good job of modeling it. I didn't call it out, but if you have any questions or comments along the way, feel free to use that chat box. We're going to be gathering the chat feedback. We're going to be gathering the live poll feedback. We're recording the session so we actually can gather the spoken feedback as well. And we will be developing all of this into a set of summary recommendations for each applicant to incorporate into their project application. All right, looks like we're mostly landing on the strongly agree and agree for this health need. Had a few more come in, okay. All right, I'm gonna go ahead and move us along to our next question. All right. So our next question is, I believe that this project is necessary to improve health in my community.
Sahara, Kathleen just asked if responses are visible to everyone. So even though we put our name in it on the back end, seems like it's not visible on the front end to anything else. So said another way.
Are you
confidential?
Okay. Are you seeing the polls move around as responses come in on the blue bars? Okay. So that is what you will see. In terms of the back end, I have a log that will show all of folks' responses, but I will not be forwarding who said what. That will not be part of the summary recommendations that make it. So if you have concerns about, I guess, confidentiality, don't worry, we are not sharing who said what. We're really kind of looking at the snapshot that these polls provide. Yep, and Michelle clarified, wonderful. All right, I feel like we have the hang of Poll Everywhere. I'm going to go ahead and move us to our next question. And this is, I'm going to put it in the chat box. I know I'm a visual person, but this is a spoken question. And the question for all of you who are community members, stakeholders, and potential partners for a proposal like this, we want to know, thinking about what you know of your region and your community, does this project duplicate or sound similar to any other initiatives or programs in the region? Do you have any recommendations to increase collaboration, maybe potential partners or folks that people should, that these applicants should maybe consider connecting with as they are fleshing out this proposal further? All right, I got a private comment says that they are not seeing any duplication.
So Sahara, these are responses to this question you want us to put in the chat box?
We can use the chat box or just speak. Yes.
Cool. Thank you.
Yes, and the reason why we're doing a spoken question for this is we landed on logistically on how to run these polls, and we figured by the time everyone typed everything in, we could have just had a quick conversation. All right, seeing some do not duplicates. Wonderful. Okay, I'm going to move us along. All right, I have beautiful. All right, I have some more feedback coming into the chat box. All right, I'm going to move us to our next live poll question. All right, I believe the implementation of this project will be successful based on the information provided. Someone said that they need more information to know. That's okay if that's that is an acceptable response. So some folks who are joining the session have maybe read some of these through the pre-read packet, or maybe have looked at these through the written survey. If you have not had the chance to do that and don't feel comfortable responding to this question or to any other question along the line, feel free to opt out. This is really just an opportunity for some kind of bidirectional communication between applicants and the communities that they're hoping to serve. All right. Okay. Fantastic. It looks like folks have mostly taken this. So I'm going to put it into the chat box. And this is a question for applicants. So this is optional. You can use the chat, you can unmute, or you can pass on this. But applicants, you have just gotten quite a bit of rapid fire feedback. I would like to know from our applicants, do you have any clarifying questions that you want to ask the group or the members of the CHI today to better understand some of the feedback or recommendations that have been discussed? Again, this is really in the spirit of clarification. This is not your dissertation that you're defending, but rather really trying, the spirit of this is to really better clarify some of the recommendations or feedback that has been shared with you today.
So Sahara, I think I might ask you to go back to this is my applicant hat.
Yes.
If you could go back to that first question, the live poll. We're gonna make that, Maddie and I are gonna make this real fast because we know we don't have a lot of time. I don't want to take too much time. I saw a strongly disagree. That was the only discordant that I saw on this one. So I don't know if somebody wants to kind of speak to the strongly disagree response there.
That was great. Someone mismarked and sent me a message that they had mismarked that. And so I was going to capture that. So good call and good catch. But this, as far as I'm aware, this is someone who mismarked, unless someone else from the group wants to come forward.
And Maddie, I don't know if you want to chime in on any questions that you have. I don't want to take anybody else's, I don't want to take any of the other applicants' time. And so I'll just plug, like, please participate in the written the written SurveyMonkey, because that is an excellent opportunity for you to read the full letter and also chat, like just type in comments to us as applicants.
Absolutely.
And thank you so much for your guys' feedback. I'm just going to say thank you and then put on my other hat.
And I just tucked in that link to that SurveyMonkey. You can open that and just leave it open on a different tab for a little bit later. But that, again, is the way to provide written feedback. If you want to learn more about these, like I said, they have the full proposal. You also can leave comments. We will be taking all of that feedback and sharing a consolidated set of recommendations with applicants. So if you have specific questions, comments, concerns, things like that, that is a really good way to share that feedback with the applicants. Wonderful. All right. Thank you for our warm-up round here. And thank you so much, Michelle, for letting us use FIRE as an opportunity to show how this works and be our first letter of intent that we reviewed. All right. Next up, I'm going to pass the virtual mic back to Michelle, and who will lead us through the rest of these, and I will be clicking slides.
Okay. Thank you. So if we have MetHow at home here, a representative from MetHow at home, please just chat in that you are here because I think it would be good for the CHI to know. So MetHow at home is the organization. The project title is MetHow Valley End of Life Resource Preparation and Support. The one sentence need statement was, we struggle with cultural aversion to conversations about aging and death. Because successfully navigating end-of-life choices and decisions takes knowledge and planning, we will increase awareness and resources in the community to facilitate our aging population's ability to manage this part of life. Their project proposal is, our goal will be to invite a widespread and multimedia conversation around end-of-life preparation and support. From wills, funerals, advanced care plans, and more, our media campaign website and collaborative education schedule will introduce language, tools, options, and strategies to address all the varied tasks we face at the end of our lives. Increasing our community's fluency and resources to address end-of-life issues and sharing these tools with other communities in our region is our goal. I'm gonna give a minute for that to sit with you all, and you can look through the funding amount requested and the white box there for that summary, and then we're going to go to our live poll. Okay, so we have our live poll. If you can type in your responses. The live poll question is, this project addresses a relevant health need or gap in my community? And we have Betsy Weiss and Tracy Sprower here from MetHow at Home. And so I'm just going to encourage Tracy and Betsy to pay attention to the responses and maybe log a couple of questions when it's time for you to ask questions of the CHI. Excellent. Sarah, can we go to the next live poll question? Okay, so this question is, I believe that this project is necessary to improve health in my community. It's a disagree to agree scale. Okay, we seem to be settling on a distribution there. Okay, so we'll go to the next question, which is a spoken question. Does this project duplicate or sound similar to other initiatives or programs in the region? Do you have any recommendations to increase collaboration? And this, you can chat in your response, or you can unmute yourself and respond. Thank you, Sarah. Again, this is a chat in or unmute. Does this project duplicate or sound similar to other initiatives in the region? And then, do you have any recommendations to increase collaboration?
I got one chat that says I don't see any duplication. Someone says it's a very needed resource. Someone asks, is this similar to Frontier Home Health and Hospice? So applicants, why don't we file that? And when we have the clarifying questions. Someone says it would overlap with hospice work, but is supportive of it. Looks like they have partners.
Excellent. Hospitals. Thank you, Megan. Okay. I think we are ready to go on to our next live poll. Thank you, Karen. This is needed all over the county. This is our live poll question. I believe that the implementation of this project will be successful based on the information provided. Keep in mind that our one sentence or our one slide overview does not do these justice, but there are full letters that provide more information. So if you feel like you have that information, please answer yes or no. And this is a live poll. Okay, excellent. Okay, so we will move on to our spoken question. Does the applicant Matt Howe at home, do you have any clarifying questions that you want to ask the groups or members of the CHI?
Hi there, this is Tracy. I am, just getting unmuted here. It's interesting to see so much neutrality coming back, and I think I'm wondering if part of that is because sometimes when we talk about end of life issues, it maybe doesn't feel like it goes along with whole person health. And but I do think that having these conversations and doing this kind of preparation does affect health of a community, and especially because end of life lacks so much support and sometimes resources. So yeah, I would just love to hear back.
Thank you, Tracy. So if anybody feels regarding the neutrality, if anybody wants to share kind of their thoughts about that question or their response, that would be great and helpful to Matt Howe at home. Anybody who was feeling kind of neutral about the health need.
Yeah, I could comment, Michelle.
Thank you, Peter.
So I think it's one of these health issues that's a little bit under the radar unless you've recently gone through something like this with a family member. And I think people are unaware of the suffering that occurs for individuals and families, and the unnecessary health resources that get devoted when people are not informed of their options or aware of what end of life looks like. So anyway, I think it's an easy issue to coast under the radar for most people. Anyway, it's understandable that it would be neutral.
Okay. Thank you, Peter. So excellent feedback there. So if there aren't any other people who want to chime in, I will just say that I think that taps on the, our final step is to kind of tap in on the discordant feedback or anything that the applicant might want to know a little bit more about. And I think Peter touched on that. So I do want to thank MetHow at Home for being here. And Tracy, are you the contact person that people should contact if they have any other questions or want to get in touch about partnerships or anything like that?
Yes.
Okay.
Yes, I can put my email into the chat box.
Excellent. Thank you, Tracy. Okay, we will move on to thank you so much for being here. And we will move on to our next applicant. Sahara, can I have you move the slideshow? Thank you. Okay, next applicant, organization North Valley Hospital. The project title is Trauma Informed Employment. The needs statement summary was that research shows students with 4 or more ACEs experience education challenges, and even after controlling for academic success, still experience lower employment rates and a high likelihood for poor health. The project proposal, this project provides a trauma-informed externship at North Valley Hospital for a subset of students from Tenascet's 2021 graduating class, with the goal of having short-term and long-term employment and health impacts on families in the community. I'm gonna let that sit with everybody for about 30 seconds. Please look at the white box to get an idea of the funding requests and the partners. And then we'll move on to our live poll. Okay, so please respond to the first live poll question. This project addresses a relevant health need or gap in my community. Strongly disagree to strongly agree scale. I'm gonna let that distribution settle. Okay, well, it keeps changing. All right, I think we kind of have an idea. I'm gonna move on to the next live poll question, if that's okay. I believe this project is critical to improving health in my community. This is a strongly disagree, agree scale, strongly agree scale. Please type in your responses to the live poll. And we're going to have an opportunity. I think we'll before we do the discussion, if have Megan maybe ask a question. She has a question here in the chat. Megan, do you want to elaborate on your question?
Sure. I can absolutely do that. I was a little confused on what the proposed project is. Is there a way that they can clarify a little bit more?
Okay.
This is John from North Valley. I can give a 15-second summary. Essentially, the idea is to relying on the high school counselors, identify students that would benefit from a vocational track experience as an externship. Meanwhile, the a number of departments working at North Valley, the supervisors in those areas would go through trauma-informed employment practices, how to be an effective manager, how to build resiliency, and how to strengthen career opportunities for that subset of students. And then there'll be an externship following graduation, working on those skills and trying to incorporate those students into the workforce, either for long-term employment at North Valley or just as a first stop after school.
Thank you, John.
Thank you, John.
Okay, so does this project, this is a spoken question, so please chat in or drop it in the chat box or unmute yourself. Does this project duplicate or sound similar to other initiatives or programs in the region? Do you have any recommendations to increase collaboration? Thank you, Lisa. Lisa says she doesn't see any duplication. Megan reports that Oroville School District was working on a similar project. Okay. Okay, so I would say maybe to get more information, maybe pick up on that comment, North Valley Hospital, and follow up on that. We're going to move on to our next live poll question. I believe that the implementation of this project will be successful based on the information provided.
And while you're voting, I just want to pop in and say the folks who are connecting with applicants, that is the spirit and the intention of which the session is structured. So thank you for that. And we hope that this leads to kind of more connections and conversations for everyone.
Okay, so at this time, we're going to ask to see if there's any clarifying questions from the applicants.
None from me, thank you.
Okay, excellent. Thank you so much, John. Okay, and I think we had our question of clarification already, and we addressed that earlier. So we're going to move on to the next applicant. This is Pateris Brewster Community Resource Center. The project title is PBCRC Technology and Counseling Centers COVID-19 Adaptations and Enhancements. The need that they are trying to address is COVID-19 has eliminated consistent in-person delivery of many social services. For example, employment searches, unemployment benefits, mental health education, and reliable internet is lacking in the PBCRC service area. The proposal is that this project will adapt the space occupied by PBCRC's tech and counseling centers to provide COVID-safe workspaces with the goal of increasing the number of clients served. So I'm going to let that sit for about 20 seconds. This one's pretty straightforward. They're asking for funding for safe workspaces so that they can increase the number of clients served. We will move on more quickly with this one because I think that it's very direct. Okay, live poll question. This project addresses a relevant health need or gap in my community.
Michelle, while people are answering, could I ask a question?
Sure, yeah, that would be great.
Yeah, so it's occurring to me that we've got a question about duplication, but I'm also asking a question in my head about, is this serving one corner of the county and not others? And I think that's something to take into consideration. And the response I'm coming to is, yes, this might be a pilot project or something that could be scaled in the future if it's successful, and probably something we should keep in mind that if we provide funding to one of these projects and it, you know, really improves the service, we should find a way to create it and make it accessible to the entire county.
Yes. And I will say that our questions, you know, don't capture the entirety of, you know, all of the points that we'd like to provide feedback for. So I will, again, do that plug for the SurveyMonkey, because this is a great thing to provide feedback on. And if that's important to you, that it right now today address a need in the entire county, or if it's important that it seeds a project that could potentially grow to the rest of the county, I think that would be a great space for that feedback. Okay. I'm going to move on to the next live poll question. I believe this project is necessary to improve health in my community. Okay, I think we've got an idea here. I'm going to move on to the spoken question. Does it duplicate or sound similar to other initiatives? And do you have any recommendations for collaboration? That is a chat in question or an unmute yourself and spoken question. Thank you, Jermaine. Okay. I'm going to move on to the next live poll. I believe the implementation of this project will be successful based on the information provided. Yes or no? Okay. And the spoken question is for the applicant. Do we have somebody from the Pateras Brewster Community Resource Center? Okay, thank you, Jean. Thank you for being here. Do you have any questions of clarification regarding the feedback so far?
We've been very fortunate to be able to provide a couple of offices here in our building for folks to remotely access services which aren't available in Pateras and Brewster. And with COVID, the remote aspect of it has increased tremendously. You know, anyone working with OBHC knows that they haven't been in person for a while. We work very closely with WorkSource and have had a WorkSource representative in our office 1 day a week, all day for, you know, about the 6 months before COVID started. And they've done everything remotely. We live in an area where there's very little internet access, and the school districts particularly are really hit hard. So what we try to do is provide internet access for the communities and for anybody that can come to the communities. And we actually reach down into Chelan County just a little bit for the folks that need to come up that direction, and across into Douglas for the folks in Bridgeport. And we just want to expand that ability by making the spaces a little bit safer so we can get more people into the rooms. You know, as it is, they're all open space rooms, and we can only have a couple of people in there at most. And, you know, as much as people hate working in cubicles, for our purposes, the cubicles are perfect.
Thank you, James.
That's what we're looking toward doing, is providing separations and partitions so that we can basically fill our rooms again and do it in a safe way.
Thank you.
You bet.
Okay. Well, thank you for coming, Jean. And I'm gonna let anybody who wants to touch base with you chat in any connections or recommendations in the chat. And we're gonna move on to our next application. Thank you so much, Jean. Okay, so these this set of applications are the applications that are regional. So they are medium and large amount applications, which means they're anywhere from 50 to 150K. And They are not only trying to address Okanagan County, so keep that in mind. They are proposals that are Okanagan County plus either Chelan, Douglas, Grant, or some combination of those, okay? So we will move on to the next slide. This applicant is Okanagan Behavioral Health Care. The project title is Rural Telehealth Kiosk Plan. The need is to improve healthcare and social services access for those in remote rural locations with a regional network of privacy-enabled broadband telehealth kiosks installed in publicly accessible remote locations, allowing those with limited or no internet access or transportation to interact with their providers. The proposal is, success will be measured by having an implementable plan with a system description, including software, hardware, and connectivity, operations plan, and budgets for a pilot project and scalable implementation plan that is functional across a broad spectrum of providers and can be used to recruit participants and secure funding. So the funding is for a implementable plan. I'm gonna let that sit with everybody for a few seconds. Please review the funding amount requested and the partners to be invited. And if there's somebody here from OBHC, if you can just chat in that you're representing this application, that would be excellent. Okay, I think we're gonna move on to our question. The project addresses a relevant health need or gap in my community. Please answer the live poll. Okay, excellent. Looks like we have a pretty solid distribution there. I'm gonna move on to the next live poll question. I believe that this project is necessary to improve health in my community. Okay. Looks like a pretty solid distribution there. So I'm gonna ask the spoken question, does this project duplicate or sound similar to other initiatives in our area or region? And do you have any recommendations to increase collaboration? Again, unmute yourself if you'd like to respond or chat in the chat box. This is the duplication question or recommendations for collaboration. Thank you, Sahara. Okay, I'm not hearing any duplication answers, but if you think of anything, please chat them in with them, you know, a little context so we know that you're responding to that question. So we'll move on to the next live poll question. I believe that the implementation of this project will be successful based on the information provided. Yes or no? And please keep in mind that there is a larger letter out there that you can view. Those letters were emailed on Monday. I can resend those as well. Excellent. Okay, so the discussion question for the applicant, I think I have somebody on here from OBHC. I have a Carol Lan, I believe, on the phone. OBHC, do you have any questions of clarification that you would like to ask the CHI regarding the feedback from today?
I know we have at least 2 folks, but one may have some muting issues, so you also can chat us and we can relay as well.
I don't know if, this is Lisa, I don't know if Carol Bell's having trouble. I know she's attending the meeting on the phone, but I think the intention of this is to pull us all together to address a gap that I think we've all seen in our community as far as folks being able to access services electronically. So this isn't just an OBHC thing, but I think we're just trying to step up and pull us all together to in our communities to address a gap that I think we're all aware of.
You. I did get a question that's chatted in. So for time, we'll probably move on, but I want to share this with the applicant for you to roll around. And the question is, are these telehealth kiosks going to be in places where Family Health Centers is not? I know that Family Health Centers is also working on growing its telehealth presence. How are these two things moving together? So that is a question for you as applicants to consider.
Thanks, Sarah. We'll do that.
And I will say that I read the full letter, and another for you to consider is the implementation plan versus the actual kiosk setup, and kind of like the timeline on that. If there's any information that can be provided in the full application, that would be helpful. Okay, thank you so much, Lisa. We are going to move on to the next applicant, Emerald Edge Media Group. The project title is Increasing Community Health Literacy. The problem we are seeking to address is low health literacy levels and a lack of mental and behavioral health information circulating in Okanogan and Douglas counties. We aim to increase availability of information, access to resources, and to diversify the way the information is delivered. We believe this will result in improved health literacy, community wellness, and utilization of local resources. I'm going to let that sit with the chai for a little bit, and then we will move on to our live poll. And if we have a rep from Emerald Edge Media Group who's representing this application, if you can chat in that you are here, that would be great.
Hey, this is Michaela. I am here. This is my company, and I am available for any questions.
Excellent. Thank you so much, Michaela. Okay. Live poll question. This project addresses a relevant health need or gap in my community. And Michaela, just to give more context, just if you can be as brief as possible in your response to this question, this is a communication style application. Is that correct?
Yeah. So basically, I'm just wanting to come forward and lay a groundwork of basic health information knowledge in our community. I'm going to try to keep this super brief, but just, I worked in community outreach at both North and Mid Valley Hospital. And I had people come forward saying that they felt like part of the gap in why people weren't utilizing resources is that people just they didn't really understand what the problem was in the first place. And so basically I'm just wanting to come forward and break down some of these concepts for our community, pool, lay a resource area, that I've heard us talk about in these chais, having a landing page, for people to be able to find something quickly and efficiently and learn something. That's kind of my goal here with this. I kind of asked for a lot just because I can reach a lot of people, figuring that some of the people that were going to come forward in these projects as well, we're also going to be needing, to be able to spread awareness about what their projects are. So I'm kind of seeing this as a comprehensive, all-inclusive kind of a thing.
Thanks, Michaela.
I hope that answered your question.
Okay, so we moved on to the next live poll question. This project is necessary to improve health in my community. Strongly disagree to strongly agree. And we're getting some responses here. Looks like we've settled on a distribution. So I'm going to go to our question of whether this project duplicates or sounds similar to other initiatives, and whether there are any recommendations to increase collaboration. Okay. Next live poll. I believe the implementation of this project will be successful based on the information provided, yes or no? Okay. And Michaela, I don't know if you are seeing this, but you'll get these summaries. And we're having a pretty split distribution on this one. And so I'm just gonna move to our next question, which is if there are any clarifications that you have, Michaela, for the CHI. Somebody asked, how would this be different than what 211 has attempted to fix? So I don't know if you have any questions of clarification. I will encourage you to, we will be summarizing the chat as well. So I would encourage you to touch base with these individuals after the meeting to follow up. Okay, the health directory for local health resources and information, how would that be different from that local health directory? So I am gonna encourage Michaela to reach out to individuals who have made some comments in the chat box. Lisa Apple would be one, would probably be a great person to contact. Okay. Thank you, Michaela, for being here, and we will follow up with feedback via email. Thank you so much.
Comprehensive, group to be able to come forward and communicate the messages that I think that our healthcare organizations have been trying to do for a very long time, and it's not getting anywhere. Another example is diabetes awareness. I mean, I sat in meeting after meeting after meeting where people say, well, we don't have enough diabetes educators in the area. Okay, well, identify that. Now I can come forward and say, well, here's another innovative way to educate the community about diabetes. And, hopefully, we can get somewhere other than just, identifying the fact that we don't have something and not doing anything about it, or not being able to do anything about it.
Okay. Thank you so much, Michaela. We are going to move on. I'm sorry to cut you off. I think we didn't hear you for a few moments there, so I apologize for that. I think you kind of cut in and out. So we will move to the next application. We'll save those chats for you. The next applicant is the Maternal Coalition. The project title is Expanding Maternal and Child Health Services. The need they hope to address: we hope to expand the workforce to ensure that pregnant and parenting people have access to just and equitable health care through doulas, community health workers, and other critical support structures. The goal is to bring more training to the North Central counties, such as doula and community health worker support. Both of these roles will Maternal Coalition in hopes that we can provide critical support identified during our listening session and survey: birth advocacy and education, child development, postpartum mood disorders, and community support the families identified as clear gaps. We also hope to partner with other organizations across the counties as well as the local hospitals to help train and recruit more doulas and community health workers. I'm gonna let that sit with the CHI for a few seconds, and then we'll move on to our live poll. Okay. We'll move on to our live poll question. This project addresses a relevant health need or gap in my community. Strongly agree to strongly disagree. Okay, we're getting a little bit of a distribution here. We're going to move on to the next question. I believe this project is critical to improving the health of my community. Okay. So the discussion question, does this project duplicate or sound similar to other initiatives in the region? And are there any suggestions for partnerships? Okay. Please feel free to provide some context if you are late to respond. Not aware of any duplication so far as one response. Let's move on to the next live poll question. I believe that the implementation of this project will be successful based on the information provided, yes or no? And I'm going to ask if there's anybody here from the Maternal Coalition who has any questions of clarification that they'd like to ask the group. Is anybody here from the Maternal Coalition? You can chat in or unmute yourself.
I could comment because I've talked with them a good deal. It was all pre-COVID, and they had come out and done some focus groups and listening sessions on kind of gaps in care, less direct clinical care and more support for pregnancy, new parenthood, and are really looking at improving providers and hospitals' ability to do childbirth education, doula support, and a lot of the work that supports families, especially the higher risk populations.
Thank you. Thank you, Jimmy. All right, well, we are gonna move on. We just have a couple more applications. So, you know, we'll probably take a few more minutes of your time. If you want to step off because you have another meeting to go to, please participate in the SurveyMonkey. That's also an opportunity to provide feedback. But we're going to finish up here. Hopefully everybody can stay on for these last couple of applicants. Okay, this is Tim Matsui, Project X. Project X, title to be determined, builds a culture of communication and collaboration through a community-based communications plan with lasting infrastructure using traditional and digital platforms to bring a politically, economically, and culturally diverse region together in addressing social determinants of health from a place of empathy, consensus, and shared experience. The proposal for the project is that they will leverage community relationships to create a network of trusted sources, people within their community to act as hyper-local voices of authority, validating science-based health interventions to positively affect social determinants of health. And harnessing the power of story and a diverse range of content delivery platforms, this communications plan will reach a wide audience and build capacity for ongoing health information campaigns. The self-perpetuation of the program is one measurement of success. The other relies on defining and the long-term measurement of hard outcomes and surrogate markers of these outcomes. So do we have Tim on the line today?
Hi there, yes.
Okay, Tim, thank you for joining us.
Thank you.
We're gonna move on to the live poll. I do wanna clarify that we don't have a lot of time for anybody to describe their project. So I'm sorry about that. The summary is that you provided is gonna have to do, and we're gonna move on to the live poll questions for this one. The project addresses a relevant health need or gap in my community. Thank you so much for coming, Tim.
Yeah.
If anybody has any questions, just chat them in, and we will make sure to connect Tim with you. Please provide your contact information if you do have a question that you would like to communicate with Tim about. Okay, we have a pretty solid distribution there. So if we can move on to the next live poll question. I believe that this project is necessary to improve health in my community.
As people are weighing in, I might want to mention that this is not a direct service, but as a communications and kind of culture shift, I think that this can support all of the other applicants that are in here and the existing programs. And so that is really my approach, is to come in and use story and first person narratives to help validate the work that everybody else is doing.
Thank you. So if anybody wants to chat in whether they feel like this duplicates or sounds similar to other initiatives in the region, that would be great. And if they have any recommendations for collaboration. And as you're getting this feedback, Tim, do you have any questions of clarification about the distributions here?
No, I mean, I think it looks, I mean, talking to a bunch of service providers, with the communications plan, it's kind of what I was expecting, I think. And so I just would love to hear some of those concerns that kind of take that communications element out of the work that you're doing and away from those direct services, and would love to hear from you all, like how a communications plan can better support what it is that you're doing.
Right. Okay.
Increase the relevancy of it, I guess.
Excellent. And I hear a chat, I see a chat in Emerald Edge and Tim Matsui have similar needs that they are trying to address. So collaboration key, building on those small storytelling pieces to build visibility, definitely lots of potential. So potential partnership, there's definitely some communications efforts going on, I think on a smaller scale. So I appreciate you coming, Tim. I really appreciate everybody for providing their feedback. And hopefully, Tim, you can connect with some of these people on potential partnerships. Oh, and if everybody can answer this last live poll question, I'm sorry. Implementation of this project, will it be successful based on the information provided?
I would also encourage our service providers on the line to take advantage of connecting with both Tim and Michaela, who are both communications professionals who are touching on a critical need that we know exists here in the county. And maybe being able to dive into Tim's question a little bit more about, you know, what, as you are working with clients and communities, what kinds of things would really be helpful for you when you have access to communications professionals.
Excellent, thank you. Okay, so Tim, and if you want to drop in your contact information, Michaela as well, I think that's a good call, Sahara. Definitely, these are communications people, experts, and it is a need. So, all right, thank you so much, Tim.
Thank you, appreciate it.
This one is the Oroville School District. The project is baseline testing protocol for reopening in-person schools. A reliable COVID testing protocol is needed for continuity of public instruction and to develop a dependable school calendar, more consumer confidence, allow families to go back to work, improve mental health, and student learning. The proposal is that this project will provide baseline testing, routine sample testing, and contact tracing to families and schools with the help of family health centers, county health officials, and private services. I'm gonna let that sit for a little bit, and then we'll move on to our live poll. Okay. Ready to move on to our live poll. This project addresses a relevant health need or gap in my community. If we can get some live poll responses here. And if anybody is here from the Oroville School District who wants to chat in that they are here, we can start pulling in some discussion pieces around duplication or potential partnerships as we're getting these live poll responses. Okay, I think we have a pretty reliable distribution here. Sahara, can we move on to the next live poll question? I believe that this project is necessary to improve health in my community. Strongly disagree to strongly agree. And again, I'm just going to check if Oroville School District is here. Anybody representing this application? And we are still providing feedback for applicants, regardless of whether they came today or not. So if you want to suggest partnerships, or if you feel like there's duplication here, please chat those in and we will be providing this information to the applicant. So any project duplication, does it sound similar to other initiatives in the region? Do you have any recommendations for collaboration? Please chat those in. I'll go to the next live poll question. I believe that the implementation of this project will be successful based on the information provided. Okay. And typically we would ask for questions of clarification from the applicant that they might want to address here. If anybody has any questions that they want the applicant to chat those in. Lori Jones says we would need more information. I would say a comment for myself would be how a school plan would be different than the community public health plan that's already being done, and whether there's partnership there. Okay. Well, I will move on to the next application. This is the last application, Communities and Schools for North Central Washington. This was a 2019 awardee. I did not know that. Excellent to know. Thank you for adding that in, Sahara. Communities and Schools Development and Expansion is the project title. The need: students in North Central Washington face many poverty-related issues, including reduced access to services, basic unmet needs, poor transportation, housing instability, and many need a bicultural, bilingual resource navigator. The proposal is that this project will support expansion of CIS services, Communities and School Services, which include site coordinators that provide individualized case management support to students through a local community network. And I'm gonna let that sit there for a few seconds and then we'll move on to our questions. Okay, let's live poll. Do we have Communities and Schools here today? Okay, so live poll question: this project addresses a relevant health need or gap in my community. strongly agree to strongly disagree. And if we have communities and schools here, if somebody can chat in that they're here for that organization, that would be great. And meanwhile, we're doing our 2 live poll questions. I would encourage you to chat in the chat box whether or not you feel like this project duplicates or sounds similar to other initiatives in the region, and if you have any recommendations to increase collaboration. To provide a little bit more context, I believe they are currently working in 2 schools in the Pacific Northwest. So just to kind of add that little context.
So Communities in Schools is actually a statewide, but there's a Little North Central organization. And last year we provided them an award to actually fund a mentor position who works closely with Orondo and Waterville. I was about to merge that into Oroville. Orondo and Waterville. And they were able to bring in folks who were bilingual, multicultural, who are working closely with students. And then they actually, when COVID kind of upended everything, they recently did a presentation for the Chelan Douglas Chai on their progress to date. And that role has turned out to be a really critical kind of community connector, working closely with students, as well as kind of making sure that there's these kind of community needs are being met. So thinking about some of the nutritional needs or access to internet, things like that. That person has been really a critical community connector up there throughout this. And so this proposal is a expansion.
So I think we'll move on to our next live poll question. I believe that this project is necessary to improve the health in my community. Agree to disagree scale. And I don't think anybody is here from this organization. So if you can chat in your comments about duplication, or if you have any questions of clarification for this applicant, that would be excellent. Any general comments that you have? Okay. And then next live poll question is, I believe that the implementation of this project would be successful based on the information provided. Yes or no? Okay. Any last comments for this application? Please chat them in. I am gonna see if we can drop that link again for the written feedback where you can read the full applications. If you guys have any questions, if the CHI has any questions about the review process, please email Sahara, and you can contact me if you have any local questions, and Sahara and I can coordinate those questions, make sure that you all get some answers to those. Sahara dropped in that link for the written feedback. Again, you get to see the full letters of interest for all of the applications, all 37 across the region. You can decide which ones you want to review fully. You can skip any ones that you don't want to review or that you might have a conflict of interest for. And I really want to thank everybody for participating in this process. Thank you so much for staying a little bit extra to make sure we gave each of our applicants equal time. And I really appreciate it. I think they appreciate it as well. And we will get this feedback to those applicants. And hopefully everybody will participate in the written feedback process. Sahara, any last comments before we let everybody go?
Just to briefly share that, well, one, to echo gratitude and thank you all for being here. Just so you know, we will be reaching out to applicants and sharing all of this information in a summary. And then I wanted to invite everyone on this call to attend. We have 2 more of these public review sessions where we will be looking at different proposals across the region. And so there will be one session hosted by the Chelan Douglas Coalition for Health Improvement on October 7th, as well as another session hosted by the ACH looking at Grant County and large regional proposals, hosted October 8th. And I will make sure all of that information makes it to Michelle to be sent out to everyone here today. Thank you so much for participating in this. We really appreciate it.
Thank you. Have a great afternoon, everybody.
Bye.
We need to save the chat, and I'm having some difficulty. So if somebody else can save the chat, that would be excellent. It's not saving as the file type that it normally saves as.
Got it.
Thank you so much. We will need that. Thank you, everybody.
I think, actually, so what usually happens is I end the meeting, so I'm gonna stop recording because we definitely don't need people